morning. Today I'll start something about, or I'll tell you something about the eye problems that can occur because of various insects like houseflies, black flies, and louse infestations, and some other parasites. Few parasites. I'll tell you here. This is what the housefly. Housefly is notorious to transmit so many infections. But as far as eye is concerned, a person having trachoma, chlamydia trachomatis infections, that is trachoma, can have discharge. That too, when it gets secondarily infected, the discharge may be there, mucopurulent, and the fly can transmit the trachoma organisms from one person to another person. That's why it's very important or very common in unhygienic conditions, more crowding, some of the areas. It's more possible for the infection to get transmitted, mainly to not only adults, mainly to children. That's most or more crowded places or houses. Now, trachoma, chlamydia trachomatis, we have got so many subtypes. Subtypes we have got classically, different subtypes are there like A, B, like this. I'll tell you. The subtypes called A, B, B small a, and C. These subtypes A, B, B, A, and C, they can transmit the classical trachoma, chlamydia trachomatis, A, B, B, A, and C, and they're going to transmit your trachoma infections to the patients. Whereas we have got other chlamydia like D to K, the subtypes. The subtypes D to K can transmit. You must be knowing one thing called adult inclusion conjunctivitis, chlamydia oculogenitalis, otherwise called in chlamydia oculogenitalis, we can have what is called swimming pool conjunctivitis. The same thing only. They are called paratrachomas. They are all coming under paratrachomas. What I'm going to tell you now, you see, these trachoma infections are classically got included in the Vision 2020 program by WHO. The chance of getting blindness is more with trachoma. That's why it was included in 1999 by WHO. Trachoma, as such, when it infects a person, we call what is called the initial bodies. The initial bodies are all going to enter the epithelial cells, and they will division takes place inside the cell to produce multiple elementary bodies. These elementary bodies are all DNA in nature, DNA. And these elementary bodies, everything together within the cytoplasm, is called as inclusion body. Inclusion body. That's why chlamydia trachomatis can produce inclusion bodies inside the cells. When these inclusion bodies are increased in number, what will happen now? It is going to occupy the entire cytoplasm of the cell, and they can rupture, and again the bodies can come out as initial body. They can infect another cell. That's what's happening in these patients. Now, what are the various problems you can expect in the eye? Normally, we can have what are called as follicles. We can have follicles like this. These are all the follicles. What is a follicle? Follicle means collection of lymphocytes, lymphocytes in the subepithelial adenoid layer of conjunctiva. Never forget that. Trachoma can produce follicles. Same thing, trachoma can produce papillae formations, papilla formations. What is papilla? These are all hyperplasia of capillaries. and sometimes new capillary formations along with inflammatory cells. So papilla can be produced, which is nothing but a capillary hyperplasia, and follicles nothing but the collection of lymphocytes. These two things can happen in trachomatis patients. To start with, they can develop follicles and papilla. This is what the classification given in trachomatis patients. But classically, what's happening now, one more problem can occur in trachoma is they can develop what is called a pannus. This is what is called pannus. What is pannus? Superficial vascularization of cornea. What is pannus means? These are some of the common viva questions for the postgraduates. Pannus or nothing but superficial vascularization of the cornea along with inflammatory cells, infiltrations of the inflammatory cells. And this pannus to start with is present between the epithelium and the Bowman's membrane of the cornea. Later on, the Bowman's may be destroyed. That is different, may be destroyed. But to start with, the pannus, the new vascularization of the cornea, the superficial vascularization of cornea, they are present in this layer between the epithelium and the Bowman's. When the vessels are more, cells are less, we call it as regressive pannus. When the cells are more, it is called progressive pannus. This pannus can occur in trachoma, mainly involving the upper part of cornea. This is what again exam questions. Pannus can occur in so many conditions, like tuberculous pannus, lepromatous pannus. So many conditions can have pannus, but they will ask you in exams, how do you differentiate these different conditions? Differentiate them. Your answer is, sir, in trachoma, usually bilateral and upper part of cornea is involved. In tuberculosis, usually unilateral and lower part of cornea is involved. Whereas in leprosy, maybe bilateral, but classically involving the temporal aspect of cornea. These are the classical questions or to differentiate the pannus of different conditions. Everyone should know this. One more peculiar feature of this follicles and trachoma. Follicles can occur in so many conditions, viral infections, drug-induced, so many conditions are there. But the follicles at trachoma, if you're asked in exams, you must tell they are larger in size, whereas in other conditions may be smaller only, larger in size and regular arrangement, regularly arranged. And one important point is what? The follicles of trachoma can undergo scarring. The scar tissue gets formed, resulting in like this. You know, have you seen this? These are all the scarring. This lines and what's called alt line. It's called alt line. Alt line. Alt line is nothing but scarring that can happen in the case of trachomas. So alt line can occur because of what? The follicles getting scarred. Because of scarring, what happens now? Because of scarring, what happens now? The lid margin can turn inside, resulting in entropion or trichiasis. That is, eyelash can turn inwards. Please remember this, what is called the sequelae. This scarring resulting in eyelid margin changes like entropion, that is inward turning of lid margin, or inward turning the eyelashes, trichiasis. These are all called sequelae. Never forget this. Now, how the trachoma patients can become blind? They will ask you a question. Your answer is, this trichiasis can rub the cornea, can rub the corneal epithelium. When the epithelium is removed or something gets damaged, now the secondary bacteria can enter inside and resulting in ulceration of cornea. This ulceration, corneal ulceration, is supposed to be called as complication of trachoma. Is supposed to occur, or it is only complication. Because of that, the patient becomes blind. Because of that, only the patient becomes blind. That is what classical trachomatis lesions. Now they will ask you, there are so many classifications. Just know that Macallan classifications, we can have Jones classifications, then we can have WHO classification like called FISTO. FISTO, this is what we are following now, FISTO. What is FISTO? F stands for follicles. I stands for intense inflammations. S for scarring. Now I told you trichiasis and ulceration after resulting in healing can produce opacity. The corneal opacity is the reason for your blindness. In the case of trachoma, never forget that. So I told now sequelae of trachoma is different. Because of trichiasis, the patient can develop an ulceration of cornea, which may result in opacity and which may be the reason for your blindness. This, as far as the trachoma is concerned, and all of you must know something about trachoma, the treatment of trachoma, the drugs used in trachoma. Here I will tell you one thing, which is called a bullet therapy. Bullet is also an exam question for you. Bullet, B-U, bullet. What is bullet therapy for trachoma? Is a common question now. Bullet. Bullet therapy means a single dose, azithromycin, 20 milligram per kg body weight. If we give orally, trachoma is no more. It can be totally cured. This is what is called bullet therapy. These are all the common viva questions as far as your trachoma is concerned. And you see here one lesion is here. You can see something in the limbus area. This is the limbal area. What happens here? We had the follicles may develop near the limbals also. Near the limbals also follicles can develop. And they can undergo scarring. A pit formation can take place. That is called Herbert pits, called Herbert pit, Herbert pit. Never forget this, Herbert pits. These are some of the questions that can be asked in exams. I told you, we got our inclusion bodies. Now we'll ask you, how do you demonstrate the inclusion bodies? Your answer is, sir, I will take a scraping of the epithelium of the conjunctiva and stain it with a Giemsa staining. Giemsa stain should be used. Now we can see the inclusion bodies as red in color, red coloration, reddish inclusion bodies can be seen with the Giemsas. Never forget this point also. So follicles, one more thing I told you, follicles are there. You know one more point here. I told you now Giemsa staining for the scraping of epithelium, which can show you the hair inclusion bodies. Everyone knows the name of the inclusion bodies. Everyone knows it's, Halber Steater. Halber Steater inclusion bodies. Halber Steater inclusion. Otherwise called as just the name HP bodies. HP. Halber Steater Provazaki. Halber Steater Provazak. P-R-O-W-Z-K. Z-E-K. Probastic inclusion bodies. These are all inclusion bodies to be demonstrated. Survival question. You should know scraping of epithelium, unstained Giemsas. The inclusion bodies can be seen as a red color. That's all. They will ask you next. One more question will ask you. I told you what is follicles. Follicles are what? Lymphocytes in the subepithelial layer of conjunctiva. You know that. So suppose I press the follicles. Press the follicle, compress the follicles, express the materials, and stay. I can see under microscope. I will see what? Apart from lymphocytes, your answer should be, we can see multinucleated giant cells, multinucleated giant cells can be seen. That is called as, never forget, that is called as Leber cells. That is called as Leber, L-E-B-R cells. Leber cells, Leber. These are also a short notes for the postgraduates. Leber cells are what? They are all cells, multinucleated giant cells that can be seen in the materials expressed from the follicles. These are all as far as the trachoma is concerned, the basics. We are not going to the details of this. Just know this. This is called the details, and then of trachoma patients or trachoma infections that can be transmitted classically by your housefly. Next is what? This is called a black fly. Black fly. Black fly is otherwise called as, I'll tell you, it's Simulium. Simulium black fly or Simulium. What's happening here? They can transmit what is called onchocerca volvulus, onchocerciasis. That means what? This is called river blindness. Like these flies are notorious to breed in the area in and around the fast flowing rivers. So naturally, a person having these onchocerca infections, when the flies bites him, they can take the materials or they take the infected materials and they can transmit to another person by biting. That's all. This is what is called onchocerciasis, river blindness, because it's normally see these flies are seen in the banks of the fast flowing rivers. That's called onchocerciasis. This is what onchocerca worms. You see now the skin in this described as lizard skin appearance. And here we'll ask you, what's the reason for your visual problem in river blindness? Never forget this. Your answer is, so the microfilaria onchocerca volvulus, they can enter your cornea, those many areas, and they can produce what is called as a sclerosing keratitis. That is the reason for blindness in a case of onchocerciasis. So onchocerca volvulus, you should know this. Here, one point of importance I'll tell you. You know, the treatment is what normally for filarial, no, they give what filarial infection. Like this is one of the filarial infection only, filarial. So naturally you have to give it what ivermectin. That you know that ivermectin. But now the importance of one thing called on the surface of onchocerca, this thing, we have got one thing called ricket cell organisms called Olbachia. That's called Olbachia. The Wolbachia is a ricket cell organism which is leading a symbiotic life with onchocerca. You know the reason here. Now onchocerca needs Wolbachia for its reproduction. Then only can produce or they can flourish. Whereas Wolbachia is taking food from the onchocerca. In turn, it helps. That's all. So Wolbachia is an organism found in onchocerca, which is required for the onchocerca reproduction procedures or reproduction natures. Now what I do? Now your answer is, sir, when I treat onchocerca, I will give ivermectin. Apart from that, I have to give some antibiotics also. What for? To kill the Wolbachia. When you kill the Wolbachia, onchocerca cannot reproduce. The generation is stopped. These are the common things about the onchocerca. I told you transmissions. Now they can, onchocerca not only be a cornea problem, they can develop optic atrophy, so many problems in the retina. Now here. Now this is what is called a tick. This is called hard tick. You see now here got spirochete, like a bacteria. It's a spirochete. It's a spirochetal organism, bacteria. This tick is responsible for transmitting a spirochete called Borrelia burgdorferi. That means Borrelia burgdorferi. That means what now here? This spirochete can be transmitted by your ixodes. This is called ixodes heart tick, which are going to be transmitted to the person, resulting in what? Classical neuroretinitis, retina problems, optic nerve problems. So many things can happen. That's called neuroretinitis. The patient can become blind. That is what heart tick, Borrelia burgdorferi. That means tick infections. That disease is called as Lyme disease. Similar to syphilis, which is also your spirochete, Treponema pallidum. We have got different stages. Like first stage, we got a secondary stage, primary, secondary, tertiary. So many stages are there. Here also we got similar to syphilis. You can have stages. Now, in first stage, patient develops what is called conjunctivitis in the cornea, conjunctiva. So inflammation of conjunctiva can take place. In the second stage of Lyme disease, the patient can develop optic neuritis, the nerve problems like Bell's palsy. This was secondary stage of Lyme disease. And then final stage of the disease, what now? Final stage, patient can develop inflammations of pars plana, axillary body area, artery occlusions, branch artery occlusions. They can develop inflammation of vessels, vasculitis, optic neuritis, uveitis. These are inflammations can occur. These are all tertiary stages. They will ask in exams, in primary stage, what problem? You can tell you, sir, conjunctivitis, sir. In secondary stage, what problem, sir? Your answer is optic neuritis, sir. In tertiary stage, classically, your question is what? Uveitis can occur in which stage? We'll ask you, in Lyme disease, uveitis occurs in which stage? Your answer is tertiary stage. That's enough. Never forget that. Now, if you're asked, which is the antibiotic of choice? Your answer is tetracyclines. Tetracyclines originally used to be called as the drug of choice. This parasite you can see now here, it's called as Taenia solium. Fourth term, Taenia solium. Taenia solium, you know, we got adult term. Whereas you can have a cysticercosis, it's called cyst. The larval forms, you can see in the vitreous, you can see in the brain, everywhere. The larva may be there. But you see now in the vitreous, it's also in the picture, you can see a cyst is here. In the center, you got a dark white area. This is called scolex. That's called scolex. Here also you can see now, a cyst is there, a scolex is here, like this. That means what? You can see the larva of Taenia solium. But never forget what? Taenia solium, the definitive host for the adult worm to harbor is human being or man. The larva, the base of human beings, I mean the adult worm, they will pass the eggs in the stools, which can be taken by pigs. The eggs enter the stomach of the pig, and they can go to various areas in the pig, muscles and all. They produce larva, cysticercosis in the muscles of the pig. Now, by chance, you take the improperly cooked meat. That is called measly pork. That is called improperly cooked meat of the pork. That's called measly pork. That means what? The larva enters the stomach of the person who has taken and becomes adult later on. That's all. That means what do you mean by here? The larva of the Taenia solium, the cysticercosis, is supposed to be found in the pig. Now you are saying larva in the man. How? The question is this. Normally you are supposed to have adult worm only. How is it possible to have larva in your body? Your answer is, sir, sometimes I can have adult worm in my intestines. When I vomit, that's called reverse peristalsis. The segments, that's called proglottids, P-R-O, proglottids, segments containing eggs enter my stomach, getting digested, and the eggs are liberated. And they can go so many portal circulations, all they can go various areas. They form a larva. This what method of getting larva? That means what? The patient should have adult worm. To have adult worm, the person should have consumed improperly cooked meat of pork. Never forget, he's a non-vegetarian fellows. He's a meat-eating fellows. This is what you're supposed to know. Whereas a vegetarian can also, a pure vegetarian was not at all taken pig at all. That means what? He may be getting. The reason is how. Please remember, by chance, you are having on the ground, the eggs are there. The ground foods like carrot, beetroot, so many things are there. They can have eggs may be attached to the surface. Now what happens now? Without cleaning these ground foods, like a beetroot and all, you take it without washing and all, the chance is there for the eggs to enter your stomach and they can develop cyst. Never forget this point. That means what? Even a vegetarian can have a cyst in your body. But to have adult worms in my intestine, I should have consumed pig. Then only can have. These are all the classical questions for exams. Now they will ask you, suppose I'm having a cyst here in the vitreous. Your answer is, how do you treat? Your answer is, sir, better option is, I will do surgical removal. I will do vitrectomy, removal of cyst in toto, along with capsule intact. It should not rupture. You know what happens? Suppose I gave a drug, man. What happens now? Suppose his cyst dies. If I give a drug, if a diggers, imagine I give a drug, albendazole, or pantop, something. We got so many things are there. Drugs to treat cyst, teniasolium. Okay, praziquantel. So when I give albendazole, what happens now? These cysts may die, but when they die, they produce severe inflammations. Within the eye, if an inflammation is there, within the vitreous, they can develop endophthalmitis, inflammation of retina, choroid. So the patient may lose the vision. That is why your answer is never, never forget, sir, surgical removal is better. Surgical removal is better, and the cyst has to be removed without rupture. This is what the exam question again. Repeat, I'm telling you now. So you have to remove the cysts. Can I see now cyst is here? Can you see a cyst is here in all the conjunctival cyst? Conjunctival, you can see the cyst, maybe in the rectus muscles, middle rectus muscles, and superior oblique muscles. So you can see the cyst in the vitreous, not only in the vitreous, under the retina, everywhere, under the conjunctiva, in the muscles also they can get lodged. In that case, if it is within the vitreous, surgical removal. Other areas you can remove. It doesn't matter. It's walled. But other areas, you can, suppose I'm having some other cyst somewhere else, I can use drugs, nothing wrong. But within the eye, be careful. Can you see now here? The conjunctival subconjunctival cyst is there. Automatically get, suppose just to make an incision, it can come out. It can easily come out. That is what the cysticercosis has come out. This is also a cyst now. You can see a cyst is here, and then you can see a scolex. This is what important question here. And I told you the life cycle. Now, one more parasites we have got classically, louse infestations, louse. What louse? We have got different louse, lice in louse is there. Head louse. I can have a body louse. I can have a crab louse. Crab. There are different types of infestations are there. Louse. Organisms may be there. Understand? These parasites may be there. But what's happening now? These louse infestations occurring in the lid margin. Lid margin. They can get adhered to the lid. That is called Theriasis palpebrarum. Theriasis palpebrarum. Palpebrarum. That's called palpebrarum. It's called theriasis. Now the question is what? From where this louse, from which area, which louse is more common to involve your lid margins? Your answer should be crab. Don't tell head louse. Don't tell head louse. Body louse and all. Most important is crab louse. Crab louse is notorious to produce blepharitis or lid margin inflammations with a louse. It's called crab louse. I'll show you some of the pictures here. See now, it's a head louse. The difference is there. It's a crab body louse and it's the crab louse. This louse is very important. As far as louse is concerned, here now the lid margins, inflammations. So this, how do you treat? How do you treat the louse infestations? Now your answer is, sir, I can cut the eyelashes. Manual removal of each louse should be done. That's what, okay, agreed. That means what? You have to remove the eyelashes and remove the louse also. Individual louse you have to remove manually, but not possible. See, so suppose I'm having 100 louse license there, 100 louses there. Naturally, it's very problematic for the patient. It's not so easy. In that case, what to do? Your answer is, sir, I can apply fluorescein, 2%. I can apply and they can get killed. Or I can get killed. That means what? That the louse infestation can be killed, or the louse can be killed. Or I can apply what is called physostigmine ointment. Physostigmine. Like neostigmine. You know that physostigmine. What is the physostigmine? It's an anticholinesterase, reversible drugs, parasympathetic mimetics. When you apply that, the louse can get persistent depolarization of the area can occur and they get paralyzed. Now you can afterwards you can remove. So always remember, one, manual removal. Never forget that. Number two, I can apply fluorescein. Number three, I can apply physostigmine ointment. suppose if I got something, available there, malathion ointment, if it is available, malathion ointment, if it is available, we can do that. This is what various infestations or the problems that can occur to your eye because of the various, like a house fly or a black fly, symbolium fly, and a louse infestation. These are all common questions and common. Never forget. You are supposed to know. I think you have learned something about these infestations. So better option is try to read also in textbooks. You will know so many things. Definitely will come across these type of patients when you are going to practice in future. Thank you very much. Thank you.